Hi, everybody. My name is Alexa. I'm coming to you from Special Needs Cobb. We're a nonprofit organization that provides residential group housing, respite services, and resources to individuals with special needs and their families in Cobb County and beyond. We are here tonight with the wonderful Rita Young of Unlock, Georgia. Rita is a longtime advocate and consultant in our local special needs community. Like many of you, she's also a special needs parent. Rita will be chatting with us today about the efforts of Unlock Georgia and how special needs parents and families can get involved in legislative advocacy on behalf of and with their loved ones with special needs. I think we're just about ready to get started. Rita, I'll go ahead and hand it off to you, and I'll be here if anyone needs help.
Thank you so much, Alexa, and thank you to Special Needs Cobb for inviting me this evening. I want to welcome you. And as I'm welcoming you, I'm going to go ahead and put up the PowerPoint presentation just to do a little check. Can everyone see that? Yes, okay, excellent. Well, again, on behalf of Unlock Georgia, I want to thank you for attending tonight's presentation. And as Alexa said, I'm Rita Young, Grassroots Engagement Director for Unlock GA. And we are a project of the Georgia Council on Developmental Disabilities, and we're administered by In Community. So I have this a couple of places in the presentation. And so if you are curious and you want to know about Unlock, I typically wait until the end, but I thought I'd try something different this time. So I'll talk about it at the beginning and the end. You can find us at Unlock Georgia, and that's Georgia all spelled out, .org. And if you'll go under the tab that says Contact Us, you can become a subscriber and receive our emails, etc. You can also find us on Facebook and Instagram at Unlock GA. And we're happy for you to join us in our socials and to become a subscriber if that's what you choose. Since I don't know, and I would love to find out the ages of your either children or adult offspring, I'm going to start assuming that not everyone may or may not know about home and community-based services. But home and community-based services are provided to individuals with disabilities and allows them to stay in their homes and in their communities instead of institutional settings. So when you hear HCBS services, that's the acronym HCBS, that's what it means. So if you know a little bit of the jargon, it's things like community living support, community access group, community residential living alternative, and respite. So we, Unlock Georgia, is an HCBS coalition. And our purpose is to monitor and respond to IDD issues related to HCBS, home and community-based services, at the state and federal level, to increase the presence of trained grassroots advocates at our state capitol and engaged in issues important to the coalition. And I'll talk a little bit more about that towards the very end. And of course, to be welcoming and inclusive of people and organizations that represent the broad base of the disability community. So currently in Unlock, it is a broad-based coalition with organizations that represent self-advocates, families, and IDD providers and others. We started about a year ago, actually. The steering committee was formed last October, so we're still a newish HCBS coalition, but wanted to give you an idea of who is on the steering committee. So these are some of the organizations. These are all of the organizations, actually. Georgia Advocacy Office, GCDD, who is our funder, Statewide Independent Living Council, Institute on Human Development and Disability at UGA, Center for Leadership and Disability at GSU, People First of Georgia, Georgia Options, Parent to Parent of Georgia, the ARC of Georgia, Service Providers Association for Developmental Disabilities, and what one is missing, and that will be Uniting for Change. And Sandra Wilcox, who happens to be watching this evening, is part of the steering committee, and she is from Uniting for Change. So Sandra, I am going to add that to this slide. Okay. So in our first year, we've been incredibly active, and it has been a very active year, actually, a little more than folks might think. There's been a lot of advocacy activity for us to just sort of dive in and get involved in right off the bat. And so I'm going to go over some of the activities over the last year, and they've centered around an IDD. And when I say IDD, it's intellectual and developmental disabilities, a Senate study committee, or an IDD rate study, the legislative session in 2023. And then the budget was signed by the governor in May, and there was something called the governor's disregard of that IDD rate study. I'll talk a little bit about that. And then also the Appendix K public health emergency. So we started at actually the perfect time, because all of these issues, some of them legislative session would have happened anyway, but these other issues were so critical, and we were able to respond to them as a steering committee. Okay, so first was the IDD study committee, and this was chaired by Senator Sally Harrell and Senators John Albers. There was something called Senate Resolution 770 here in Georgia. And there was a committee that was formed partly with some of our state reps and senators, and also members of the IDD community that represent statewide organizations. And the issue was to talk about services, what's going right, the waiting list, really an opportunity for the community to get engaged. And so the IDD study committee started last August. They met in several locations, twice in Atlanta at the Capitol, and then also in Tifton and in Rome. That started us off. Also, there's continuing concern over the waiting list in Georgia for Medicaid waivers, for those now comp waiver. If you don't know what that is, please let me know, and I can give you a general description of what a Medicaid waiver is. Here we go. Again, not taking it for granted that you may or may not know. It's basically a funding mechanism for individuals with IDD to pay for services using Medicaid. So again, it's those home and community-based services. Individuals, families can go the provider route and use a traditional provider, or they can what's called self-direct or participant direct their services. And in Georgia, we have about 14,000 people that currently receive waiver services. Our waiting list for services is about 7,000 individuals. The last legislative session, we were able, as a DD community, able to secure 513 new waivers. And then in 2023, this legislative session, the one most recent, we were able to secure 500 new waivers, and those would have started the implementation process and distribution July 1st. And that is most certainly a key priority for us in the 2024 legislative session. We are concerned that the numbers have been low. 500 and 513 is actually, in my opinion, very respectable, but we have a huge list and we could do so much better. If for some reason you have not applied for a Medicaid waiver and are curious about that process, I just wanted to include some information here for you. Here's the website where you can look at applying online. These are the items that they ask. This is directly a screenshot from that website. So as you can see, it's a bit of a list, but some of these items hopefully are very accessible to you. Some of them may take a little bit of time to request those documents, etc. But it is a bit of a lengthy list, but the way that they've made it a little bit easier for all of us is to accept the information online. And then if you're curious, you all are in Region 1 here, but the state is DBHDD. This is directly from their website. If you had questions and you wanted to reach out to your regional representatives, I'm assuming a lot of you are in Region 1 for Cobb because we're special needs Cobb, but there are others from across the state as well. So I wanted to provide that map to you. Another issue that has popped up that I'm not going to spend a lot of time on, but I wanted you all to be aware of, that people with IDD are being abandoned in emergency rooms for non-medical reasons. And some of the time it's because of lack of staff to be able to provide adequate care. Some of the time it is because an aging caregiver has passed and there's no one, again, to take their place. So it's an issue that we are watching. The state is most definitely concerned about this as well. And I just wanted you all to be aware of it because it's critical, and it really points to the lack of support staff that a lot of organizations have. And I know everyone's trying their best to be able to hire direct support staff, et cetera, but it is an issue in our state that I wanted you to be aware of. So that takes us to direct support professional wages. And this is another key priority for Unlock GA. There is currently a workforce shortage in many fields and arenas, but we feel it most definitely in the IDD community. Average staff turnover rates, and staff meaning direct support staff, is 46%. So low rates hinder recruitment, retention, and of course they impact the quality of services. The current published rate per hour, this is what the providers are reimbursed for, is $10.70 an hour for direct support staff. Now, a good bit of them do private fundraising, so they're able to pay a little bit more, but it became an issue, of course, during the public health emergency during COVID-19, when everything sort of was amplified, right? So the last increase in published hourly rates in Georgia for direct support professionals and other categories as well was 10 years ago. So there was a rate study that was commissioned last year, and the findings were published in December, January of this year, December of last year. And so this was an incredibly positive step for Georgia to go ahead and do another rate study, because obviously $10.70, that's a really hard number to be able to work with if you're looking for direct support staff. A lot of time, energy, review, public comment went into the workforce, excuse me, not the workforce, but the IDD rate study. And so although it's not perfect, once the rates pass, which that's a process in itself, it takes a good bit of time to do that. The published rate will be $16.70. So quite a lot of work still has to be done in order for that to occur, but it is where we're headed. And as I mentioned, it's a key priority for us in the 2024 legislative session. And then Appendix K is, again, during the public health emergency, the Centers for Medicare and Medicaid provided extra flexibilities to states in how they implemented and executed their waiver programs. And so this is again something that was scheduled to end next in just a few weeks, right? So there were a couple of items in there that we advocated very strongly for. And the flexibilities, as I mentioned, will be ending, or were scheduled to end November 11th. But in August, the Centers for Medicare and Medicaid gave states the option to extend certain flexibilities. And so we provided public comments in September for the flexibilities that the state was looking at, and specifically was the 10% rate increase, which was during COVID, right? We didn't want that to be yanked away. And then also the family caregiver hire for the now comp waivers. So I know that folks are very interested in that, and we expect that to be approved at the next, along with that 10%, that, you know, we don't want that to, again, to be yanked back on November 9th. So the Department of Community Health, their board will vote for final adoption on that on November 9th. Again, that's a process, but we feel that that is moving in the right direction. So we had, as I mentioned, many opportunities to respond to advocacy during this last year. The first one, again, was the recommendations to the IDD Senate Study Committee. And we testified as a steering committee. We provided oral testimony and written testimony, specifically on the rates for direct support professionals and also the waiting list, and just the length and the time that people are on the waiting list. And we want to see that reduced, most definitely. We also, same thing in terms of the IDD rate study, responding to that with written comments, specifically again on the rates, and wanting to see that implementation go through. Georgia also passed, we were not involved in this, but Georgia also passed a law where rates now, there will be a rate study every 4 years. So we think that that's a positive move also, instead of, you know, every 10, 12 years or so, right? So at least now every 4 years, we know that there will be another rate study that is commissioned by the Department of Behavioral Health and Developmental Disabilities. During the legislative session, we also supported advocates to testify at the Capitol. And so I was very privileged and honored to support a young man with Down syndrome, Miles, who provided testimony for Unlock at the House and Senate appropriations hearings, as well as several other parents, 3 other parents that also stepped up and wanted to provide testimony at those meetings as well. We also have met with key leadership. So, and when I mean key leadership in the House and Senate, that is at our state capitol here, not up in DC. We're not there yet, although we will be moving in that direction on the federal side this next year. So we were able to meet with House and Senate appropriation chairs to talk to them again about more waivers and DSP wages. And one of the subcommittee chairs said this is the most she's heard about waivers in a very long time. So we were pleased that as a community, we really pushed this issue that we need more waivers in our budget, as well as the DSP wages. In May, the governor signed the budget for this next year, which started on July 1st. And the IDD rate study was put in sort of as a placeholder. It's $107 million item. And because the funds were not needed yet, and we're really just trying to figure out why the governor put a disregard on that particular line item. And so we weren't special. There were many disregards. I think there were about 200 disregards in the budget, or some very large number, if not that large. But it still hurt us. And so what that means is that during this legislative session, we'll really have to work hard to push that 107 rather $1 million ask for the IDD rate study to be implemented. And also, we responded to the Georgia Department of Community Health and the Department of Behavioral Health and Developmental Disabilities, advocating for those Appendix K flexibilities to be extended. And when I talk about that, it is specifically for that additional 10% for providers and for families that self-direct. And then also to keep the family caregiver hire in the now and comp waivers. In addition to that, and I promise I will take questions very soon and do kind of a check-in with folks. This is a lot of information to digest, and I'm really happy to go over it again. If you have questions, if you need things to be reiterated, etc., I'm happy to do that. We also provided some community education. And in April and May of this year, we provided a 5-part Lunch and Learn series on disability advocacy. And it was specifically from a curriculum written by the creators of the Netflix film Crip Camp. Has anyone seen that film, Crip Camp? I would highly recommend you watch it. It is really about the birth of the disability movement in the 70s and the group of teenagers that really birthed that movement. It's a beautiful film. We did that. And in our next year, we've purchased a new online advocacy platform, which we are going to be integrating with our website, so that you will be able to go in and add your information, find out who your legislators are at the state level, at the federal level. We're real excited and what the issues are. We'll be able to communicate and do research on the issues at the state and federal level. So we'll be enhancing the website and social media. We will be opening the coalition meetings to community advocates, probably at least quarterly, if not more. So we'll be posting that information and sending it out to Unlock subscribers too. We'll be forming 2 subcommittees, marketing and membership. And we are piloting a new legislative advocacy training, and you can become an Unlock certified advocate. And of course, we will be looking to grow the coalition membership. Okay, so let me see if I've got. I'm going to go back. So again, you can join us at unlockgeorgia.com, Facebook, Instagram. We will have an Unlock advocacy training starting December 5th. That's coming up. I'm going to talk a little bit more about that. Let me see if I have any. Yes, I do. Got it there. Okay. Okay. In year 2, our 3 key areas will be the implementation of that rate study. And that is, again, directly because we want to see direct support professionals paid a fair wage. Not a poverty wage, a fair wage. Our whole system really depends on that. And then also in Georgia, more now comp waivers in the DBHDD budget. We're wanting to reduce that waiting list. Those 2 are our key issues at the state level. And then the federal, which we will be developing in year 2, is the portability of Medicaid waivers. So folks, some people don't know this, but I would want you to know this. If you have a waiver, say you get a waiver in Georgia, you wait 10 years in Georgia and you decide, well, I'm going to retire to Florida. I'm going to retire and I want my son or daughter to come with me. Well, you leave that waiver here and you have to start all over in another state and vice versa. So I had talked to a mom a while back who moved here from Florida. She waited on the list in Florida, got a waiver. Then when she moved here, she thought automatically it would be transferred, and it's not. So you have to start all over again. And this is a critical issue for families. It can be quite limiting if you can't move state to state. Again, if you want to take your son or daughter with you, it's for a job, or maybe a sibling lives out of state and the parents have passed, and that sibling bringing them to that particular state, that waiver is not portable. So we are concerned about that, and that is an issue that we believe needs to change. The new training that we're talking about as well, you can become an Unlock certified advocate. It's going to be a monthly training starting in December. It will be in person and virtual. So it'll look something like this, and the information is on the form here if you would like to get more information or to apply. But December will be virtual for an hour and a half in the evening. January will be at the Capitol, taking a tour of the Capitol, doing a mock testimony type exercise, learning the ropes at the Capitol. February and March will be virtual, again, an evening, and I've got the topics on that Google form there. And then April will be a graduation in person in the Atlanta area. So we will take 20 this first year, 10 family members and 10 self-advocates. And so I highly encourage you and invite you, if this is something that you're interested in, we would absolutely love to have you join us. Here's the schedule that I was just talking about. So we're going to be talking about state legislative issues in December. January, we will be at our state capitol. February, we'll talk about the state budget cycle, key committees and leadership. March, federal issues, and then in April, we will do a graduation in the Atlanta area. Okay, folks, I am the form link in the chat. Okay, Lisa, I think we can do that. But I would absolutely love to take any questions, thoughts that you all had. This presentation went by a little bit quicker than I had anticipated, but there's lots of time to hear from you on your with your questions or anything that's you are concerned about.
Miss Rita,
Yes.
what was you saying about January?
Go back to that slide. Is this what you meant, the training? So Sandra, we're just now developing a training that will start in December.
Okay.
And will be in January. The date in January is to be decided. The dates in February, March, and April are set here. And we will be taking a tour of the Capitol and kind of learning how to navigate the Capitol during the legislative session, but this will be right before it starts. So it will be a lot less hectic. And so that's what we're going to be doing. We'll be doing some training on how to give testimony that day.
Okay, what about next month? Yeah, we're not doing anything next month?
Next month, so for folks that don't know, Sandra is a steering committee member. I mentioned this early on. Sandra, we do have a meeting in October and November for the steering committee members.
Okay.
So yes, we will be meeting.
Okay. What date? What's the date?
I don't have it in front of me. Can I send that to you, Sandra? I think it's the 26th. Yeah, I think I'm.
Yes, ma'am. Yes, ma'am. You may.
All right. Anything else, Sandra?
No, ma'am. That'll be all.
Okay. Lisa's saying, yes. I'm watching that Lisa conversation online, and yeah, with Appendix K, there are so many concerns for parent caregivers under the age of 18, which are on FSS, family support services, or GAP. I know what GAP is, but I'm assuming FSS is family support services, and waitlisted for now comp. Yeah, so I'm seeing some advocacy. I'm assuming that you're a part of that advocacy that's going on online with the Department of Community Health. Did I get that right? But yes, it is an issue. And I'm so sorry to hear that it is, I think there still is hope. I think, but it will require a good bit of advocacy, and which it sounds like from what I'm seeing, there's a lot of momentum building. So I'm really hopeful and curious if that's going to go in a good direction. There's a lack of communication on the parent side and the nursing agency side. Lack of communication from the agency, from DCH, or within parents. Let me know how you mean, Lisa. Michelle, I see your comment too. I'm happy to do that. I'm going to just scroll up to make sure I'm not missing anyone. Okay, Lisa's issue was the GAP and family caregiver. Yes, I agree with that, absolutely. And I look forward to seeing the advocacy momentum build for that. Are people taking advantage of the DBHDD crisis hotline? My son finally got attention to get into the group home after we called the crisis line. They came out several times because grants off the wall behavior. I don't know, Jane, are folks aware of that? There is it's called GCAL. There's a crisis hotline that DBHDD has set for quite a few years now. It's at least maybe over 10 years, maybe close to 10 years, they've had this crisis line. And, to me, it's unfortunate that you have to, I know that you needed to call the crisis line, but in order to get services, you certainly got their attention, right? I'm assuming that's what you mean. Yeah, my son finally got the attention. Yes. Thank you for sharing that with us. I think that's helpful for others. It's really scary when you're in a crisis situation. So I'm glad you were able to get the help. Hopefully the crisis line was helpful and they sent folks out. And then again, what that does is that triggers at the regional level for your son to get a little bit more attention when they're seeing the call to the crisis line. How can we confirm if you are on the wait list? Every year I do an interview for my twins for the waiver, but want to ensure they're on the waiting list. You could confirm with the planning list administrator in your region if you're in region 1. If you do an interview, that's a good sign, but it certainly wouldn't hurt to call the region and say, I just want to confirm, how do I get confirmation that they're still on the wait list? And I think it's actually a really smart idea to do that, because you just never know, right? With administrative records, et cetera, when things move from paper to electronic. So I think it's really wise, Michelle, for you to do that. So the Appendix K was the flexibilities. Appendix K is for waivers across the country. The Centers for Medicare and Medicaid provided certain flexibilities during the public health emergency. And then it gave states the options just a couple of months ago to extend those past November 11th, but the state had to ask for the ones to extend, right? And so on the now comp side, they are looking at, I think, like I said, I mean, unless something really outrageous happens, it will be approved November 9th. And what will happen then is it goes to CMS to get a final approval. So all of this takes time, right? But the flexibilities were an increase that providers and self-direct families received during the public health emergency of an extra 10%. And then also family caregiver hire for now comp waivers. Okay, I see from Bobby Dodd. Okay, Lisa, that helps. I appreciate you letting me know that, Lisa. I was not aware on the family support side that families were being hired. And so that, to your knowledge, will end November 11th. So Michelle, you're asking the link to get whose information? Just let me know. I somehow I missed that. What's the average?
The DBHDD planning coordinator to check on the application status.
Are you in Cobb County? What county are you in?
Michelle says, yeah, she's in Cobb County.
Okay. Region 1, if I was able to quick look that up for you, I could, but Region 1 is the region that you're in if you're in Cobb County. So I would call and ask for one of the planning list administrators and tell them that you would like confirmation that your children are still on the waiting list. Call or email. You could email the, although calling might be a little bit easier because I think the only published names they might have are sort of the regional coordinators. Oh, I forgot the title. I'm bad with titles, but anyway, so the person that is the managerial head of each region. So you could go that route, or you could try to give them a call. Okay, Carrie asks, what's the average turnaround time for an application to interview and then approval? I was told that nearly half of the applicants are denied and usually have to appeal. Carrie, do you mean for waivers? It sounds like what you're describing might be for Social Security, but do you mean waivers? Let's see here. Waiver, okay. Yeah, I don't know what the average time for turnaround is. However, I have 2 videos that you might be interested in. They're on my YouTube channel called Real Talk with Rita. I have a playlist on waivers, and it's just 2 interviews. And the first interview is with the person that determines eligibility. It's Dr. Kelly Bishop. And then the second interview is with Dr. Jeff Thompson, and he talks about that waiver distribution. Okay, so it's going to give you a lot of information. I mean, it's basically a training on the eligibility process and then how you get from that waiting list. They call it planning list, but we call it waiting list, the planning list to services. Yes, Lisa, I did hear that the most intensive family support services and funding was drastically reduced. Absolutely, I did hear that. And that just happened very recently. Trying to catch up as to why, but I do know that it was reduced. Very sorry to hear that. I'm gonna just scroll here and see if Michelle, did that give you an understanding of the Appendix K? I'm assuming that you might have a waiver. You know, talking about applying for the waiver, I think one of the positive things about having it centralized as they do, it didn't always used to be that way, is that you will get a confirmation that your application was received, but I would still call, wait a little bit and call just to be sure that it's received on their end. Technology is supposed to make things a lot easier, but you just never know. So yeah. Other questions about advocacy? I'll talk a little bit about my experience with advocacy and how important it was. I have two sons that are both autistic, and they're 30 and 20. Well, they just had birthdays. 31 now and 29. It's hard to believe. And so when they were 5 and 3, I took an advocacy program that we used to have in Georgia called Partners in Policymaking. And it really changed the trajectory of my life and my journey with my sons, and professional trajectory as well. And so if you have the time and if you have the interest to get involved in talking with policymakers about why services for individuals with IDD are so critical, I would highly encourage you to do that. And you don't have to do it alone. You can join Unlock, and you know what our priorities are in terms of higher wages for DSP, for staff, direct support professionals, elimination, reduction of that waiting list, and then waiver portability. And so we invite you to join us as well. And it's actually, we try to make advocacy fun too. So when you come down to the legislative session, I certainly, or there are others as well, that can support you in that process, to talk to your legislator during the session or after, before the legislative session. It's real important because our legislators, our House members, our Senate members are just, as you can imagine, bombarded by all types of issues. And unless you have a direct knowledge, whether with a family member, maybe your neighbor, etc., preferably maybe your family member, most of the legislators don't really have a lot of the knowledge about the issues that affect our families. Now, some of them do, because they've been legislators for quite a while. And so, I'm always very hopeful, but there's a lot that this is new for. And then, so there's a lot of members that are new too, newly elected, et cetera. And it's really important for us to talk to them, to get to know them, and for them to get to know us, so they can vote on the issues and advocate for us in terms of waivers, wages. It's just important to connect with them so that they know that this issue is important.
We also have another workshop coming up on November 6th on financial planning with Jeff Wright of Wright Wealth. I'll be sending out the invite to that as well, and I'll go ahead and put the link to our workshops page. You can already get registered for that. Thank you all for coming. Rita, thank you so much for doing this wonderful workshop for everyone. I really appreciate it. I'm sure everyone does here as well. But to everybody else, have a great night.